The topic we're going to study is sedative hypnotics, which in a very layman term are the sleeping pills, also include the anti-anxiety drugs and some anti-seizure drugs. First of all, we're going to study classification or the groups of drugs included is in this. First group is the benzos, the benzodiazepines. Then come barbiturates. Then there are some other miscellaneous drugs which act through other receptors and other mechanisms. First, which drugs we are going to focus on are the benzodiazepines. On the basis of the duration of action, these benzodiazepines are divided into some other mini groups as the short acting, the intermediate acting, and the long acting ones. The short acting one, it's triazolam, which you can try to remember by the trying in a very short period of time. Then there is the intermediate acting drugs, alprazolam. Okay, a very, very interesting drug. Many of you know about it. But can anyone guess its name? It's Xanax. This drug is used as an anxiolytic in acute anxiety attacks, in panic disorders. It is a very important drug in generalized anxiety disorders. So remember alprazolam. Then the long-acting drugs. Now this category also includes the most important drug among the benzodiazepines. It's the diazepam, coming by the name of Valium. You might have heard about it. If not, then you're going to hear about it a lot because it is a very important anti-seizure drug. So Valium or diazepam. Other drugs included in this category are flurazepam, temazepam. So benzodiazepines, basically what are the uses of benzodiazepines? They are used as sedatives. This diazepam can be given as an anti-seizure as well as uh, as a muscle relaxant in acute spasm conditions. Okay, and seizure disorders like diazepam, acute epileptic attacks, especially we just give a shot of diazepam, then as anxiolytics, our old friend Xanax. After knowing the uses of this drug, what we also need to know is what happens if we take it in an overdose. Sleeping pill overdose is not very unheard of. Then, in that case, we have to give an antidote, that is flumazenil. Now, one thing you need to know about flumazenil is that it can act as an antidote for benzodiazepines but not for barbiturates because of different receptor sites on the GABA receptor. So, there are some other type of drugs which are included in the Z's category in the miscellaneous group, the zolpidem, zaleplon. It can also act as an antidote for those drugs because the receptor sites of benzodiazepines and those Z's are very close together, but it cannot act as an antidote for barbiturates. So, this is a very important point that you need to remember. Then there are the adverse effects, majorly CNS depression. That is why it was very bad if it was an overdose because depression it will shut down your CNS. Okay, the sleeping pills can have a very bad effect on the respiratory system. It can cause respiratory depression as well, but it is and coma also. But it is more common with the barbiturates than with the benzodiazepines. Addiction, of course, or dependency, and withdrawal will lead to an insomnia. Before diving into the mechanism of action, we will see what our other drug group has. It is also divided on the basis of action of duration of action. I'm very sorry. Ultra short acting drugs, short acting, and long acting. So the ultra short acting one is thiopental. Then there is the short acting one, ecobarbital, and the long acting one, which you might have heard about, phenobarbital. Now this one is also an anti-seizure drug. Now barbiturates don't have an anxiolytic action, but they are also used as anti-seizure drugs and anesthetics. While secobarbital is mainly for sedation, as we talked about before. So these are the uses of the barbiturates. Flumazenil does not act as an antidote for barbiturates, as I told earlier. Then there are the adverse effects. As I told you before, this one also causes CNS depression, but as well as CNS depression, these are also prone to cause respiratory depression, may lead to coma. These effects are more common with barbiturates than with benzodiazepines. Plus, the addiction and dependency will also be present, as we all very well know. So this concludes us with our barbiturate. The last group we are going to study about is the miscellaneous group. So this group has many different drugs which act through many different mechanisms. For example, the first drug is bispirone. Bispirone acts through the serotonin receptor, while the benzos and the barbiturates are acting through the GABA receptor. This one has a separate, totally different receptor and a mechanism of action. And what it is used for mostly is generalized anxiety disorders. second drug we are going to study about is Rameltion. You don't need to worry about it. I am going to explain all of these mechanisms in a separate video in very much more detail in an attempt to make you remember properly, actually remember these drugs. Okay, then there is Rameltion. This one acts through the melatonin receptor. It's also used for insomnia, i.e. for sedation, but this one has a much lower dependency. Same with them. Okay, Rameltion. Then there are the Z's putting you to sleep. These also acts through the GABA receptor, but through the benzodiazepine site of the receptor. The receptor is nearer to the receptor of benzodiazepines, which is why the antidote we studied for benzodiazepines will also act as an antidote for disease. So these are also used for insomnia and with a very low risk for dependency. Then there is suvorexant, which is an orexin antagonist. Orexin is basically uh, a neurotransmitter or a chemical, you can say, which is secreted from the reticular activating system in order to wake, and suvorexant will antagonize its action to make us fall asleep. So yeah, this also has a very low dependency. But this suvorexant is contraindicated in narcolepsy. The last are the antihistamines, which we all know are the anti-allergics. Fall asleep. Why? We will study why. This concludes our classification of sedative hypnotics.